Good afternoon. I am Colonel Scott Hughes, your 87th Medical Group Commander. The topics we will discuss at today's town hall include COVID-19 vaccine eligibility and priorities, vaccine administration on Joint Base McGuire-Dix-Lakehurst, the Pfizer vaccine we are administering, and the public health implications of vaccination. A question and answer session will follow that will be transcribed and posted on this site within the next few days, most likely tomorrow. Joining the panel today, on my left, is Dr. McKeown. Would you like to introduce yourself?
Yes, good afternoon. My name is Dr. Connor McKeown. I'm a family medicine physician by training and working on the installation as the chief of the medical staff at the 87th Medical Group.
On my right is Dr. Kipp.
I'm Dr. Rich Kipp. I'm an aerospace medicine specialist, and I'm also the installation public health emergency officer.
First, thank you for joining us today. Seeking the facts on vaccination to make informed decisions for yourself and your family is extraordinarily important. It is our hope that you will share the information provided today with others in your sphere of influence to help others close to you reach informed vaccine decisions as well. For military installations, COVID-19 vaccine priorities are informed by the Centers for Disease Control recommendations and determined by the Department of Defense. The DoD published a priority chart that groups people eligible for vaccination into 4 major phases: Phase 1A, Phase 1B, Phase 1C, and Phase 2. The original schema only had 3 phases, so there has been some reshuffling of priorities since the first vaccines were administered on JBMDL on December 31st. Momentarily, I will address each phase and where we are operating currently. First, we have 2 major categories of vaccine eligibility. The first major category is Tricare eligible patients living within 40 miles of the installation. If you are eligible for Tricare and live near the installation, then you are eligible for the COVID-19 vaccination on JBMDL. So that's retirees, dependents, everyone who has Tricare. Foreign military members stationed locally are also eligible. The second major category of eligibility is the workforce on JBMDL. If you work on a JBMDL as a GS civilian, you are eligible. If you are a NAF employee, you are eligible. If you work for DECA or APHES, you are eligible. And if you work with children on the base, you too are eligible. If you are a contractor on the base who is required to participate in an occupational health program, or you are a contractor eligible for other vaccinations from the medical group, like the flu shot, you are also eligible for a COVID vaccination on JBMDL. Now that we know who is eligible, I will go over the 4 major phased priority groups. These priorities are subject to change as DoD makes updates. The current DoD priority schema is published on the 87th Medical Group Facebook page if you would like to follow along. First, Phase 1A. This phase focuses on healthcare workers and first responders serving the JBMDL installation. This includes security forces, fire, and medical workers. All have been offered the vaccine. Those who have not been vaccinated yet remain our top priority as they decide to be vaccinated. If you fit this criteria and work on JBMDL, you will be able to access our online reservation system very soon. I will discuss the reservation system more in a minute. Then we have Phase 1B. Phase 1B formerly included JBMDL workforce members identified as mission essential by unit commanders as they interpret the DoD priority schema. Unit commanders have been actively identifying mission essential members to the 87 MDG. 2 weeks ago, the mission essential members could be vaccinated. However, the latest priority schema moves mission essential workforce members down to Phase 1C. So currently in Phase 1B are personnel preparing to deploy within 90 days, including those in alert or standby status to deploy. It also includes all people aged 75 and over from both the Tricare beneficiary and the JBMDL workforce populations. It also includes the installation's frontline essential workers described as employees working on JBMDL with youth services or childcare, and frontline workers at the commissary, post office, all food workers plus frontline APs workers, including those in the food court and barbershop. Phase 1A and Phase 1B are the only two priority groups being scheduled at JBMDL for vaccination right now. We have over 10,000 people in these two groups and so far have only received 2,000 first dose vaccines, all of which have been administered. Based on current vaccine projections, we will not make it to the Phase 1C before March. On to Phase 1C. As shared a few moments ago, Phase 1C includes members identified by their unit commanders as mission essential in accordance with the DoD Priority Schema guidance. Phase 1C also includes all vaccine eligibles aged 65 and up, both from the JBMDL workforce and Tricare beneficiary populations. It also includes eligible population age 16 to 64 who are at increased risk for severe illness. Conditions increasing risk for severe illness are found in the footnote of DoD's phased population schema. The 87th Medical Group knows who has which conditions based on medical records and Tricare claims. Since we are likely more than a month away from having vaccine for the Phase 1C population, we will not be addressing Phase 1C notification processes for elevated risk individuals today. Notification tools are evolving very quickly and will likely change by March. However, I do recommend that you ensure your phone number and mailing address are correct in DEERS in the event that we send out a robocall or mail letters. The last priority of the four priorities is Phase 2. Phase 2 is for all healthy vaccine eligibles aged 16 and up. The majority of healthy uniform members will be offered vaccination in Phase 2. Circling back to reservations for the vaccine, the medical group is working with a secured web scheduling service hosted by Appointy, that's Appointy. We anticipate launching this web reservation service within the next few days for the Phase 1A and Phase 1B priority groups, as well as anyone who needs their second dose of Pfizer vaccine from the 87th Medical Group. For people who believe they are frontline workers belonging to the Phase 1B priority group, you must have been identified to the 87th Medical Group as a frontline worker, or else you will be turned away at the door even if you have a reservation in Appointy. The same is true for people who believe they are mission essential members belonging to Phase 1C. All organizational units on JBMDL know how to identify Phase 1B and Phase 1C members to the 87th Medical Group. If not, the unit should reach out to the Emergency Operations Center for instructions. Our COVID vaccination site for JBMDL is the McGuire Fitness Center. The vaccination site will only be stood up when we have doses available to administer. The site will administer over 1,000 vaccines per day when the supply chain allows. For the 87th Medical Group, COVID vaccinations are not being scheduled by phone. Our Appointy reservation link will be posted on the 87th Med Group Facebook page very soon for Phase 1A, Phase 1B, and second dose vaccinations only. Second dose vaccinations are available tomorrow afternoon, next Wednesday, and next Friday to anyone who had their first dose 21 days ago or longer, even without an Appointy reservation. However, an Appointy reservation is recommended so a dose is thawed and ready for you. The 87th Med Group Facebook site will post the most current information on DoD priorities, vaccination FAQs, and information on how to reserve vaccinations. Lastly, please be aware that the state of New Jersey also has a vaccine reservation website found at www.nj.gov. New Jersey is using a very similar priority schema as the DoD. Now over to Dr. McKeown to talk more about the Pfizer vaccine.
Yes, good afternoon, everybody. So we're really excited about the vaccine. We're really happy and excited that we have it available for some people at this time. And part of what we want to do today is be able to talk a little bit more about it and hopefully increase confidence in the vaccine. And you know, as Colonel Hughes mentioned, we know that not everybody can get it right now, but we want everybody to want to get it when the time comes and be able to make that choice. Because really this is going to be the best way to get rid of COVID, or at least get our lives back to a little bit more normal. So as was mentioned, right now we have two vaccines that have been approved by the FDA. We have a Pfizer vaccine and a Moderna vaccine. Both of them are vaccines that are administered in the upper arm in the deltoid muscle for the most part. They are both mRNA vaccines, and both of them are given in a 2-shot series. The Pfizer vaccine is typically given the first dose, and then a second dose would be 21 days later. And the Moderna vaccine, the second dose could be given 28 days later. Now, of note, be aware that you shouldn't get the vaccine earlier than those days, but you can get it later. So as we go along with the scheduling, please be aware that you might have your second dose scheduled maybe a few days, maybe even a week or so after the 21 days or the 28 days, depending on the vaccine that we have. So just be aware, you shouldn't get it earlier, but you can get it later, and that's okay. These are mRNA vaccines. I'll talk a little bit more about mRNA vaccines in a minute. Possible side effects that are associated with these vaccines could include pain, swelling, redness at the injection site, fatigue, fever, headache, chills, swollen lymph nodes, typical unwell feelings. Now, this is typical and normal with a lot of vaccines, and this vaccine is no exception. There's the possibility that you may feel a little sick afterwards, but usually that only lasts a day to 2 days, and truthfully, typically it hasn't been terrible. Anecdotally, people do feel a little bit worse after the second dose that they get, but again, doesn't last too long, and should it's a lot better than actually getting COVID. I do want to note also that there are a lot of people that are a little concerned because this was developed so quickly. I will note that we should take this as a win, and it really is miraculous and really a groundbreaking thing that this vaccine was developed so quickly. Now, no shortcuts were taken. It has been found to be extremely safe and extremely effective, and really the FDA looked at all the data and determined that it was extremely safe and effective. And like I said, I just hope that we can increase confidence in that. Now, as I mentioned, these are mRNA vaccines. So what that is messenger RNA. It is the technology behind it is actually pretty neat. And it's a new vaccine. These ones are the first ones that are ever been used with this, but it has been studied for many years actually. And I think that everything kind of lined up pretty well for this, that they've been studying it for so long. Once the coronavirus came along, all hands went into this and all hands on deck, and they were able to really focus on this technology and get it taken care of pretty quickly. And actually it's pretty amazing the way that it happened and everything that went into it. What happens with it is the mRNA enters into our body and is taken and helps actually teach our cells to create a protein that is similar to the protein that's found on coronavirus, and as such it can it helps our body trigger an immune response that creates these antibodies to it. A couple of things to note, because I've seen these questions come up. The mRNA actually does not enter into the nucleus of the cell. The nucleus of the cell is where our DNA is kept. Because it doesn't enter into the nucleus of our cell, there's no actual possibility that it will interact with our DNA at all. Additionally, after it does its job, after it teaches our body to trigger this immune response, our body actually degrades the mRNA and pretty much just destroys it. So it doesn't hang out in our body any longer than it needs to. It does its job, and then it's gone. Now, a couple other questions that have come up. What exactly is in the vaccine? So as I mentioned, mRNA. There's also lipids in it, and what that is it's fats. Our body contains lipids already, but it's fats that help the mRNA get to where it needs to go, and that's all the lipids do. It has salts. Again, these are things that are naturally in our body anyways, but what the salts do is it helps kind of maintain this acidity within our bodies. It also has some sugars that help maintain the molecules at cold temperatures that are required for freezing. Now, again, Pfizer and Moderna are both very open about what's in their vaccines. If you have questions, it's very, very open. What's not in the vaccine? So no eggs, no egg products, no dairy, no wheat, no. I've seen this question come up as well. It does not contain any aborted fetal tissue. Nothing like that. Like I said, the companies are actually very open about what exactly is in there. And so, additionally, it actually doesn't contain any live or inactivated COVID, and as such, you cannot get COVID from the vaccine either. So even if you feel a little bit sick for a day or two afterwards, you have no chance of getting COVID from the vaccine itself. Wanted to go into a little bit as well who gets the vaccine or who is eligible. As was mentioned, so the Pfizer vaccine is approved for individuals age 16 and up, and the Moderna vaccine is eligible for individuals age 18 and up. Anybody really can get it. The only contraindication is if you have a history of a severe allergic reaction to one of the ingredients in the vaccine. So, like I said, if you have a history of severe allergy, and when I say severe, I'm talking about people who have respiratory distress or severe rash and respiratory distress after getting vaccines in the past. And so, make sure you look up the ingredients. Like I said, if you have that history, and just make sure. But that would be the only true contraindication. People who are immunocompromised, those are those high-risk groups that we actually recommend that they get the vaccine, because they are the ones that could potentially get very sick from COVID, and so it's really recommended that those individuals get it. Pregnancy, it's hard to do studies on pregnancy. There's no data to suggest that it's harmful in pregnancy at all. Usually, if you look on the CDC website, it'll probably say, talk to your healthcare provider. But again, it's not contraindicated in pregnancy, and in fact, pregnancy is considered one of those high-risk conditions that we usually would recommend you get the vaccine. Additionally, one of the questions that I've seen come up as well is, can this cause infertility? Again, no data to suggest that the vaccine would cause infertility. And again, like I said, it's pretty limited on what's actually inside these vaccines. So very unlikely that it should cause any future problems. There are some things that we don't know, though. So there's not a whole lot of long-term data, and just because it was developed pretty quickly. But again, all the data it shows that it seems to be very effective. And but with that, there's always the possibility, and maybe even a strong possibility, that we may need an annual booster or some sort of booster in the future. We don't know how long our immunity will last with this vaccine. Additionally, one thing that we don't know is when it will be available for kids under the age of 16. So I know that those studies are being done right now. It may be some time, but again, hopefully we'll get to the point where enough people are vaccinated, enough people are immune, that even within the next several months we can get back to a little bit more normal, even though maybe our kids won't be able to get vaccinated quite yet. But that's our hope. And lastly, before I turn the time over to back to Colonel Hughes, just wanted to mention about the natural courses of viruses. So I'm sure a lot of people have heard in the media about some of these new strains of COVID, some of these new mutations. Just wanted to briefly talk about that the natural course of a virus is to change with time. A virus in general wants to do what it can to become more efficient, and that's kind of what these things are doing, and they often are mutating, often changing. That's natural for a virus, and it's unfortunate because, like I said, they oftentimes become more contagious, more effective and efficient with time. But so far, all the data suggests that our vaccines that are available right now are effective against those strains as well, and so that's good news. And again, we need to do all that we can to kick COVID to the curb. We need to get everybody to be excited about this vaccine, be happy about it. Hopefully within the next few months we'll have enough vaccine to be able to get everybody that wants to be vaccinated. We're really, really excited about that.
Yeah, thank you, Dr. McKeown. And so, just want to encourage the folks that are watching live right now. Please send your questions on in, and we'll start answering questions right after Dr. Kipp. So, Dr. Kipp is going to talk about public health and vaccination.
Sure. So like all of us, we're excited. These vaccines are going to offer another layer of protection for us against the virus. What they're not going to do right away is remove the need for us to continue to do social distancing, mask wear, hand washing. First and foremost with the vaccines, that they're not effective right away. And so even after you've gotten your vaccines, you do not have that immunity right away. Best data, it's about a week to 2 weeks after your second dose. And even then, we're going to need to continue to do all the things that have been the bedrock throughout this entire pandemic. What we hope to see, what we will see, is more people get vaccinated as we continue to stay socially distanced and wear our masks, that those disease rates will fall off. We'll stop finding the virus. People will stop getting sick. Those will be the markers for us to start returning back to some sort of normal life, the things that we used to get back to. So please, when you have your opportunity, please get your shot. And if you have questions, please ask them now. I've told my own unit, if someone makes a decision not to get the vaccine, I understand and I support that, but I don't want it to be for lack of a question that we could have asked or potentially something we could have clarified for you. All three of us here, I will add, did get our second doses. We were quite excited about them, and so we're happy to answer questions about that as well.
Yeah, I know I felt an incredible sense of relief after getting that second dose, but realistically, I know that we're not out of the woods yet, and so I look forward to having enough vaccine supply to share that sense of relief with everybody. And so, do we have any questions coming in?
Yes, sir. So one of the first big questions is, will this be a yearly vaccine? How long do the shots last?
McKeown?
Yeah, so I'll take a stab. As I mentioned, unfortunately, we don't have that data. So we don't know how long the immunity will last for with this vaccine. It is quite possible that it will become a booster. I don't know if that's an annual booster or if we will just need another shot here in the next few years. So unfortunately, the answer to that question is we don't know. We just don't have long enough. Right now, the goal is just to get as many people vaccinated as possible and see if we can, as Dr. Kipp mentioned, see if we can get those numbers coming down. And if we can do that, then we can get back to closer to normal, and hopefully, we may in the future need more vaccine, need more shots, but that's still to be determined, I guess.
Thank you.
When you say Tricare members are eligible, does that include Tricare For Life?
It does. Yes, it does. Absolutely.
Will you be having a standby capability to ensure that you don't waste vaccines?
We will not waste vaccines. We are very good about thawing the right number every day and making sure that if we have any left, that we have some folks on standby.
Can you explain how members sign up in a little more of the website?
I can. We haven't released the web link yet, and it will be released soon. But it will be a link on our Facebook page, and we'll also add one to our Med Group homepage, hosted by the Defense Health Agency. But it's a simple click on the link. You find the category that corresponds to your priority, and you will be able to click on there, put in your email address and your name, and sign up for the date and the time. And so it will only be available again to the Phase 1A and Phase 1B at this point. But I would encourage you to take a look at it and start getting familiar with it as soon as we launch it in the next few days.
For individuals that tested positive for COVID, are they eligible to get the vaccine, and how long do they need to wait to get the vaccine?
Yeah, so that is a good question, and yes, you are eligible to get the vaccine. One thing with COVID I will mention is we don't know. So it is thought that once you have COVID, you probably have some immunity for some period of time. But that is one of the things that is really unknown right now is how much immunity is it all that strong, and how long does that immunity last for? We hear different numbers thrown out there, and it's just unknown. So we do recommend people who've had COVID to get the vaccine. The only thing I've seen from as far as recommendation is just wait till you're out of isolation and feeling better. That's really the only thing that I've seen as far as when you can get it, how long you have to wait. So there's no set period of time besides just being released by a provider from isolation, and just as long as you're feeling pretty good, you should be able to get it. I don't know if any other thoughts.
No, so I think you will see on some websites they'll talk about wait 90 days. I'll be honest, and Dr. McKeown's correct. So really, there's no real indication to not get it within those 90 days. Really, right now with limited vaccine, really that's based around the idea that we think for about 90 days you're probably immune from COVID if you naturally acquire the immunity. And so the idea was potentially allowing some people without any natural immunity to get that vaccination. I will say here for us on the Joint Base, that has not been something that we've been actively screening for. But agree. I think once you feel better, come on in and we'll get you vaccinated.
Thank you. Next question.
So when are we expecting a full FDA approval versus the current emergency authorization?
So that's a great question, and we don't know the answer to that. My understanding is that it often takes 18 months, but I also know that the federal government is moving through the bureaucratic process as fast as possible without cutting any safety corners.
Will individuals be notified when they are eligible to get the vaccine?
So the notification will be mostly passive through our website, and so we will keep everybody up to speed on what phase we are in. So currently we are in phase 1B and above, and when we move to phase 1C, that will be posted on our website.
We're expecting 1C to start in March.
I would not expect 1C to start before March, based off of current projections. I don't know if it will start in March or not. The flow of vaccine has been quite limited to all the states, including our DoD jurisdiction. It is certainly my hope. That we will be to that group in March, but I do not know for sure.
And I know you all three already addressed it, but a lot of people are asking about eligibility again. Can you do a quick rundown of the different groups one more time, sir?
So this video will be posted for anybody to review once more on the website, and we will have the full FAQs posted tomorrow also. And so I think when you see this posted in writing, it'll help clarify things for you.
Is there a plan to identify and administer the vaccine for essential workers that are military dependents?
If they work on the base, absolutely. We are also not the only source for vaccines. The state of New Jersey, state of Pennsylvania are also sources that are prioritizing certain groups, including healthcare workers and folks over 75 at the moment.
Can you talk about the liability waiver patients are asked to sign before the vaccine?
There is no liability waiver patients are asked to sign before vaccination. The only form that patients are working with prior to vaccination is the medical screening form. And that medical screening form is either a consent or non-consent to being vaccinated.
If you get COVID after the shots, will it be less severe?
So I can talk about that a little. So, we've had a number. So some people do get COVID after the shots. As I mentioned, it's a 95% effective rate, but it's supposed to be close to 100% effective against severe disease. And nothing can be truly 100% effective, but they say that because they haven't really had that many cases of severe disease. They haven't had any cases, I don't think, of severe disease in people who've gotten the shots. So I think after the first shot, if you got it, it might be the same. I don't really know that data yet, but after the second shot, it is supposed to be less severe if you were to get it.
Yeah, I'd just say that notably, I want to say somewhere around 20 million people have received this shot so far in the U.S., and others have received it elsewhere outside the U.S. And so we're really building up quite a high level of experience with it at this point.
At any point, are we expecting the vaccine to be mandatory?
There is no indication of the vaccine becoming mandatory at this point, and only the president can make it mandatory while it's under emergency use authorization. And I have not personally seen any indication that President Biden intends to do so.
For those that got the first vaccine, what happens if there's a shortage for the second shot?
So, great question. We have vaccine that we receive specifically for the second dose. Now, if individuals don't come in to receive the second dose on time, we will keep on moving on and administer it to somebody else as a first dose. But come on in and take care of business within that 21, 28 days. We're hoping to see everybody, and if you miss out on it, you will be a priority for the next round of vaccines that do come in.
If you get COVID in between your 2 shots, does that impact getting your second dose or induce a revaccination?
So no, it would not impact. You would still get your second dose. Again, I would recommend waiting until you get better from COVID before getting that second shot, but you should still get it, and you wouldn't have to start the series over again.
Great questions. Keep them coming, please.
If you can still get COVID, what are the benefits of getting the vaccine?
Dr. Kipp, you want to take this one?
Sure. So first and foremost, like any vaccine, it is still possible to get disease. So the flu shot, infinitely important that we get it every year, but still possible to get flu. Like that flu shot, like other vaccines, like Dr. McKeown's already said, your risk of severe disease is almost completely reduced. And those that do get COVID after the vaccine series will get much less disease overall. The data is we're still looking into the data, but we all suspect that as the data goes on, it's also much less likely for you to pass on. So right now, we still have to do our social distancing and mask wear, but typically we would expect for vaccines of this type that the data is going to bear out that you're actually less likely to pass it on to other people as well. And so really this becomes, one, protecting yourself, one, from the virus, but two, if you are going to get sick, you'll be much less sick, and you may not know you have the virus at all. And also for those around you, those loved ones, the people you work with, protecting them as well. So frankly, the benefits are many, the risks are very, very few.
I will add also, I hear from a lot of our young population that, if I get COVID, it probably won't be that bad. So a lot of people aren't worried about getting COVID. But I do want to mention, I talk to a lot of people who have COVID. I've talked to many, many people over the months. And yes, many people get over it pretty quickly, but there's a lot of people that get really, really sick. Even if you don't die from it, there's a lot of people that get really, really sick, and a lot of people that get sick for a very long period of time as well. And a lot of people get, even these young people, we've had, young people get hospitalized, and young people get really, really sick, and we also don't have a whole lot of long-term data on COVID itself, and so there are some studies and thoughts that people who had it will potentially have longer-term issues, and we don't know for sure, but there are people who, in some high-level athletes that have had it, they are shown to have a lot of less ability to be conditioned and stuff afterwards. They're not able to do as much as they were able to do previously. So I would caution that school of thought of, I'm young, I'm healthy, I think I'll be fine from COVID, because that's not always the case, and we've seen that, and it's unfortunate.
Are there differences between the first and second doses, or are they the exact same?
So they're the exact same vaccine itself. Again, that first dose is mainly meant to kind of prime the body, get the body ready for an immune response, and that second one really triggers that immune response. So as I mentioned, anecdotally, people do sometimes have more side effects after that second that second dose. I'll tell you just from my personal experience, I felt fine after both of them. If I pushed on my arm, it did hurt a little bit. I think I kind of made myself believe that after that second dose, I was a little bit more tired the next day, but I don't know if I would have thought much of it otherwise. But that was my personal experience. But otherwise, the answer to the question is they're the exact same.
It's interesting. It's the same. It's the exact same shot, but your body can very well respond differently to the second dose from the first dose. I'll tell you, I felt great after the first dose, sore arm, that was it. Second dose, I felt a little bit under the weather, and so people do respond differently to the first and the second, but same shot.
If you get travel orders or TDY frequently, will you be required to get the vaccine before leaving?
There is no requirement for anybody to be vaccinated with the COVID-19 vaccination.
How do we know when reservations are available for subsequent phases?
So we will keep folks apprised of which phase we're operating in, and we will make appointments available for that phase, and it will be very clear on the website which phase it is that the appointment is for.
Why is it in 2 shots rather than 1?
Again, as I mentioned with the mRNA vaccines, this is a new technology, but it's really quite interesting, and quite miraculous, like I said. But the reason they have the 2 shots is the first dose is really meant to kind of prime the body and prepare it for that immune response, but the data has shown that it's just not enough to really trigger a full immune response, but it really does a good job of preparing it. After that second dose, that's where the immune response really occurs, and that's why you need that second one. There's some studies to suggest there may be some immunity after that first dose, but really you need both those doses to have a full immunity.
Are there any known reactions to the vaccine?
Yes. As I mentioned, a lot of people have pretty much no reaction at all, but some individuals will feel under the weather. They'll feel some fatigue, low-grade fever, chills, body aches, sometimes swollen lymph nodes. Very, very rarely, and as was mentioned, there's been 20 million shots given already in the U.S., and there's been very rare reactions that are really severe, and what we call anaphylactic reactions, and that's where you have really difficulty breathing and rash. So, as I mentioned, the only true contraindication to the vaccine is if you've had a reaction like that in the past to vaccines that are similar to this or have those ingredients in it. But there are some known side effects, and then very, very rarely is a really severe side effect. And again, with those side effects, typically they'll last 1 to 2 days.
So we're talking mostly headache, fevers. What are the side effects that folks might experience?
Yeah, so those typical reactions. So headache, low-grade fever, body aches, fatigue, joint pains, swollen lymph nodes. Those are the types of possible reactions, and those would be considered normal. I would say, for the most part, if you were to feel that, just kind of rest. You may need a fever reducer if you feel like you need one. But again, mostly just rest, and it'll get better over the course of a day or 2.
Yeah, great question. Thank you.
Can individuals with asthma, allergies, or other things that require general medication able to take the vaccine?
Yes, and in fact, those are the types of people that are really those high-risk individuals, and that we'd really encourage to get the vaccine. People who have chronic lung disease or chronic medical conditions, those are the ones that have the potential of getting really sick from COVID, and those are the ones that really should really think hard about getting the vaccine, because those are the ones that are going to benefit really, really a lot.
Is there a plan for isolation or quarantine if you are in close contact to a positive person after both doses?
So like I said, right now, the answer is yes. So right now, based on the CDC, because again, what we don't know, what we don't have data for, because that's just not how studies are designed when we test vaccines, is what your risk is of passing on the disease. So right now, even if you've completed both doses, the need for quarantine and isolation remains the same. That being said, I think we all hope and expect as we get more and more data that we may be able to modify that. But as it stands now, those still stay the same.
Yeah, and where do we look for our guidelines on that?
Right. So that's from the CDC, and so CDC, very open source, certainly can go to the CDC website, and they have recommendations for both quarantine and isolation. And on there as well, they discuss how to handle someone who's post-vaccination and has both their doses.
Thank you. Great question.
Can you contract COVID from the actual vaccine?
So no, some vaccines, contain live virus. The COVID vaccine does not, and so because of that, there's absolutely no chance of actually getting COVID from the vaccine. Now, sometimes, I've heard stories of people who have gotten the vaccine or have gotten COVID shortly after getting maybe the first dose or something like that. But that wouldn't have come from the dose. That would have come from a contact or previous exposure to COVID. And so again, no, you cannot get COVID from the vaccine.
So I'll just add, there's many different vaccines being developed right now. The two approved vaccines, Pfizer and Moderna, are not live vaccines, and there is absolutely zero COVID in either one of them. Okay.
How will having the vaccine impact contact tracing, if at all?
Yeah, so again, right now, being vaccinated will not affect contact tracing, and again, that's from the Center for Disease Control and their recommendation right now. Again, my hope, all our hopes, is that as we move forward and we learn more information about the vaccine and how it works, that will change. But as of right now, there's no change to contact tracing with the vaccine.
Can you talk a little bit more about the mRNA technology?
Sure. I love it. No,
We're going to geek out for a second.
No, as I mentioned, this is really pretty neat and actually really groundbreaking. It's been studied for many years, and I think what really happened with this particular one was as I mentioned, everything kind of lined up right. They've already been studying it, but when COVID came along, they were able to just pour a ton of resources into it and be able to really get it going here. As I mentioned, the mRNA enters our body, and rather than really, if you know much about biology, the mRNA usually has a code in it, and we have mRNA in our body. But this one has a particular code that actually teaches our cells to create a protein called the spike protein that is similar to what's found on COVID. And what that does is it teaches our body to create an immune response and so that we can create antibodies and be able to fight against COVID. Again, this is really cool technology, and really because they've been studying it for so long, they really were able to pour the resources in and get it. And really, it is groundbreaking and gives us potential for other diseases to be able to use this technology in the future. And so I think it's a really cool thing. It's really something that pay attention to over the next few years. Is maybe there will be some other groundbreaking things that come out of this.
I'll offer too. So this research, and we move so quickly, it's really standing on the shoulders of other research. So some may remember this is actually not our first coronavirus we've been concerned about. So SARS-CoV some years ago, and then also MERS-CoV, so in the Middle East, broke out. Both those are coronaviruses, and at the time, both research started on vaccinations for both of those viruses. Those turned out not to be nearly as infectious as COVID-19, but nevertheless, the research was done. So in many ways, our ability to do as quick as we was because we had already started in many ways looking into how to fight coronaviruses.
Are there any other vaccines that have the mRNA technology that you can compare this vaccine to?
So no, as was mentioned, this is the first, so we got the two right now, and these are the first times that these mRNA technology has been used. So no, but it's been studied for quite some time, but no other vaccine has the mRNA.
Is there a difference between the two-shot vaccine administered on base and the J&J vaccine?
I don't know exactly what the J&J vaccine is. Is that the Johnson & Johnson?
Especially the
Okay.
Johnson & Johnson.
So there is a difference. Would you like to talk about the difference?
Sure.
Okay.
The Johnson & Johnson vaccine, which I first have to preface, the Johnson & Johnson vaccine does not have emergency use authorization. I'm not actually aware that it's been submitted just yet. I know we're all hopeful that it will. So its main difference is that it does appear to be a one-shot vaccine. We don't know yet. We'll wait for them to release how good it is, how efficacious it is. Compared to the mRNA vaccine, it actually uses a virus vector, right? So what that means is they actually took adenovirus, which is another virus that causes colds. They tinkered with that adenovirus, so it can't cause colds for you and actually can't replicate. But that adenovirus is what actually introduces the mRNA and everything into your cells and the other viral particles. And so they use another virus essentially to get the vaccine into your cells. Compared to both these, which really, again, very clean. It's just this little strand of mRNA, which I'll also add. The mRNA strand in these vaccines is actually not pulled from coronavirus itself. It's actually made in a lab. So when Colonel Hughes says there's no virus, and there's literally no coronavirus in the vaccine we have. So very hopeful, and there's actually other vaccinations coming that also use different techniques as well. So what I would say for the Johnson & Johnson, it is probably more of a typical vaccine that we have. It follows more of a traditional method to vaccinate people.
Yeah, so I believe they would consider the J&J vaccine to be a live virus vaccine. Is that because of the adenovirus or because of the COVID virus?
Yeah, adenovirus, sir.
I couldn't quite hear you.
So again, that adenovirus, but they're using a different virus that they make sure can't make us sick as a method to introduce coronavirus particles into our cells. So again, the goal being to elicit that immune response from the body. But again, anxious to see that get approved, because obviously that is one more vaccine that we can push out there, and also it being a one-shot series certainly does offer a lot of help. And then finally, really anxious to see how efficacious it is. But again, I'll offer that the flu vaccine is typically around 70% effective. So that should say two things. One, if that one's 60 or 70%, that's great. But it also highlights how darn effective the Pfizer and Moderna vaccines are at 95 and 94% effective.
Yeah, so clearly, we haven't seen the data on the J&J vaccine yet. But for those that are concerned about the newness of the technology of the mRNA vaccines, the J&J vaccine is the much more traditional vaccine that most folks are very familiar with.
I'll just reiterate again with regards to the mRNA vaccine. After it does its job, the mRNA is broken up and degraded, so it doesn't stay in our body for very long.
Right. I think the biggest challenge why it's taken so long to bring along mRNA vaccines is how delicate that mRNA is, and so when we talk about the 80 degrees below necessary for the Pfizer vaccine, all those big logistics leaps had to be made to really stabilize that long enough, and so it does not survive long in the body.
Yeah, and one more time I'll say this because I've heard the question come up a few times before, is just it does not enter into the nucleus of the cell where our DNA is kept, and so it does not alter our DNA. It doesn't interact with our DNA at all. So like I said, I've just heard that question a few times, so I just want to reiterate that again for anyone that came later.
And this will be the final question: is walk-in availability offered, or do you have to register beforehand?
So there is no walk-in availability at this time. Perhaps sometime down the road when we have a lot more supply, but right now we are very carefully scheduling folks to come in. So thank you very much. Really appreciate all those fantastic questions today. Dr. McKeown, is there anything that you just want to make sure folks walk away with in terms of information?
Yeah, just the main thing. I think we went over a lot, and as Colonel Hughes said, thank you everybody for the questions. Great questions. The main thing is that we need to do our collective part as a community. We really want to get people vaccinated just so that we can really get our lives back to normal, and that's really going to be the way that we do it. It is a little unfortunate right now just that we have to go a little bit slower than we'd like to, but hopefully within the next few months we have enough vaccine that we can open the floodgates and get everybody vaccinated that wants it, and that's our real hope here coming up soon, and hopefully those watching can disseminate this information and feel a little bit more comfortable and have a little bit more confidence in getting the vaccine.
Dr. Kipp, do you have a bottom line that you'd like to share?
Yeah, first and foremost, again, please continue to look out for each other, social distance, hand wash, wear your masks. And again, if you have questions that we didn't answer or other questions come up, please reach out to your primary care manager. If that's at the 87th Medical Group, our doctors, nurses, nurse practitioners, physicians assistants are all prepared and ready to answer your questions. If it's not with us, please reach out to your primary care and have those conversations. I don't want anyone to turn away the vaccine, turn away the opportunity simply because there was a question we could have asked or a conversation that could have been had.
Yeah, I'll just end with, vaccine hesitancy is normal, okay? And so if you are experiencing vaccine hesitancy, that is a very normal feeling. What we see is that vaccine hesitancy reduces as those in our trusted circles are vaccinated, and as we learn more about the vaccine itself. And so really our goal here today is to provide as much education as possible to help you understand these vaccines, and so that you can make your own informed decision. We encourage all to seek the facts from reputable sources, such as the Centers for Disease Control, such as the Food and Drug Administration, from Pfizer directly, from Moderna, from your physician. We encourage all to seek facts from reputable sources so that your decision is informed very well, and that you can make the right choices for yourself and your family. Again, thank you for tuning in today. Please share that this recording will be posted online, and we will have a transcript of the questions posted online as well tomorrow. Have a nice day. Thank you.